Thanks for joining for another VC Health. Today we are joined with Lorenzo Lewis of the Confess Project, Bruce Trimble of the Bridgeway, and Ken Clark of Chenal Family Therapy. I'm Annalise, a project manager here at the Venture Center, and I'm super excited to be hosting this today. So again, thank y'all for joining. Before we get started, I do want to give a shout out to our sponsors, the Bridgeway, Chenal Family Therapy, Frost Accounting, Wright Lindsay Jennings, and Little Rock Regional Chamber, and Simmons Bank. Again, thank you all for your continued support. And then I want to go ahead and give y'all a glimpse into some upcoming programs we've got going on here at the Venture Center. So on November 10th, our Spark cohort is pitching, and so we've got a pitch contest at Brewski's on November 10th at 6 p.m. You can find more information on our Facebook and website. And then we've got another VC Health in November. On November 12th will be Bruce and Ken are going to chat with Shirley Walker, who is a veteran entrepreneur here locally. And then last, we've got a Lift the Rock on November 19th featuring Jeff Franklin and Kathy Webb. And we'll learn more about the how a business can get started and how a city can help. So Bruce and Ken and Lorenzo, I'm going to go ahead and hand it off to y'all.
Okay, if you'll allow me to share my screen.
Yeah, I think you're good to go.
Okay. Okay, so I'm Bruce Trimble. I'm with the Bridgeway Hospital, and we're very happy to have everybody here today. I want to remind everyone to practice self-care. Some of these topics can trigger different emotions, and so we have got a licensed clinical social worker on call from noon to 1:30 today at no charge. You can call or text her. If there's any questions after hours, feel free to call Chenal Family Therapy, the Bridgeway, or another provider. So this year we have talked with the VC Health program in depth about mental health and how it impacts Americans of all ages. Today, we're going to talk about the state of mental health of America, the state of mental health of African Americans, and some resources for...
Bruce, I'm so sorry to cut you off. We just see a black screen right now.
Oh. Okay. What do you see now?
You.
Okay.
There you go.
Okay. So again, we'll talk today about state of mental health of America, state of mental health of African Americans, and some resources for African American entrepreneurs. Well, we've talked more about the state of mental health in America, and one of the things we've learned is that the mental health of our youth is worsening. Even before COVID, we saw a higher prevalence of mental illness among adults, and we're seeing higher suicidal ideation among adults as well. From a racial or ethnic perspective, typically those groups tend to suffer from poor mental health outcomes due to multiple factors, including inaccessibility of high mental health care services, the cultural stigma surrounding mental health care and discrimination, and just the overall lack of awareness about mental health. Comparing the different groups, people from racial and ethnic minority groups are less likely to receive mental health care. And when you look at compared to 2015, 48% of whites received mental health services compared to 31% of Blacks and Hispanics and 22% of Asians. The barriers there's several factors that present as barriers for ethnic groups. One is the lack of insurance or underinsurance. The mental health or mental illness stigma is often greater among minority populations. There's often a lack of diversity among mental health care providers, a lack of cultural competent providers, language barriers, and often a distrust in the healthcare system, and then overall an inadequate support for mental health services in the safety net through insurance. But there are resources. In response to the Black Lives Matter movement, the African American Behavioral Health Center of Excellence was founded just this year. I've listed here 55 mental health resources for people of color. There is a group here on how to work with African American or Black patients. So if there's anybody in the group who has a clinical background and is working with African Americans, there are some resources here. And then finally, we have got the Confess Project, which we'll hear more about today from Lorenzo Lewis. But the Confess Project is an Arkansas-based organization that is working to equip men of color with mental health strategies and coping skills. So without any further ado, I'm going to hand it off now to my friend and colleague, Ken Clark.
Hey, everybody. Thanks for having me. Absolutely honored to share the stage with Lorenzo. You guys are in for a treat today, as well as Bruce. And thanks to the Venture Center for all they're doing. I want to share a couple thoughts dovetailing off Bruce, and then a couple thoughts for entrepreneurs in caring for folks. I hope the thoughts challenge you. I hope they bother you, or you stick your foot in your mouth. You send me a very emphatic email. And we're going to talk about some of the things that entrepreneurs can do to make sure that the mental health of all people is considered in what they do. Like Bruce said, there's both a lower rate of adoption, but more importantly, a lower rate of access for a variety of folks across the landscape and in the workplace. And that applies to our BIPOC brothers and sisters and folks at lower socioeconomic status. So this is an active challenge and need in both the community landscape, but also the entrepreneurial landscape that we ensure equal access is there. Aside from it being the right thing to do and an obligation that we have to one another within our community to look out for one another, it's also part of a healthy entrepreneurial ecosystem, right? If the folks that are coming into our workplace, our customers, our employees, coworkers, vendors, even ourselves, if we're not in a good place, if we're not in a safe place, if we don't have access to what we need to continue to work on the baggage we carry, the traumas we carry, things like that, then we perform at lower levels. It hurts the economy and all that. So aside from it just being the right thing to do to make sure that we look at all this, it is also clearly the smart thing to do. Having said that, my admonition today is more, or my goal today is more to admonish those that have some ability to change things, as it is to point out the obvious. What we do know is that the problems in particular with access and stigma and those things are often controlled by a small group of people. Oftentimes they're people that look like me, come from a background like me, tends to be Caucasian and male and straight. And if we want to ensure that all people in our community have access, those that hold privilege, which is a tough discussion for some of us to wrestle with, but those of us that hold privilege need to begin looking at our responsibility to be proactive, to make sure that anti-racism stances are part of our quest to provide better mental health. We cannot say that we believe in mental health, but not be anti-racist at the same time. And so I want to encourage you all to, whatever position of power or privilege you hold within an organization, within a household, to begin having a dialogue that is about change and contribution, because simply not being part of the problem is not enough. And we would argue that not being part of the solution is being part of the problem. Specifically, there's some things that I want to point out that is really, really important for leaders of workplaces, companies, people that are shaping brands and things like that, begin to look at. And first and foremost, like I previously mentioned, the concept of privilege is something that we all need to wrestle with. Whether or not you agree with it, disagree with it, you cannot ignore it as a central concept in a lot of people's mental health and in everybody's mental health. And in our company, we try and acknowledge the fact that everybody holds privilege somehow. That bosses and employees and senior coworkers and people with more education or people with knees that work a little better than my old knees, everybody holds privilege somehow. And on the opposite side of privilege is almost always going to be fear. That the people that hold power in my life, however they hold it, I always carry the fear that they will misuse or miswield that privilege. And that exists everywhere. And we need to begin looking at that if we really want to contribute to mental health in workspaces and in the community. Is where do we hold privilege? How does that generate fear for other people, regardless of whether or not we use that privilege responsibly? So that's first and foremost. We cannot have this discussion without recognizing that there's inherent imbalances in power and fear. And those things have a huge impact on mental health. Number two, we need to ensure that that the folks with less power, less privilege in any situation aren't the ones that are having to drive these conversations. If we believe that mental health among our African American brothers and sisters, LGBTQ community, any of these things are important, we cannot leave it to them to drive that discussion. We need to, as white business owners, be talking to white business owners about what it means to be anti-racist and ensure equity and opportunity exists for all people. We need to be talking about this among ourselves as men or women or straight people or whatever. But it's crucial that we do not put the burden solely on individuals who are already struggling with marginalization to be the ones that change our minds. So any of us that are aligned in these beliefs need to take the additional hard step and drive discussion. We need to, in ourselves, continue to, as business owners, leaders, influencers, anytime you're given a stage like this, if you're any of these folks, even in your household, right, there's people that look to you probably. We need to continue to do our own work. The intention of us not exhibiting bias or being part of the systematic holding back of people is not enough. Sometimes there is a natural momentum to who we are, where we were born, how we were raised, and the intention to not add to the problem is not enough. And so if we care about the mental health of anything from however we classify people, from our workers, co-workers, vendors, whatever, to those that we identify within certain groups, we have to do our own work. We have to look at how bias and systematic power and those things creep into our decision making, how we interview, how we promote, how we make safe. We cannot be part of a mental health landscape that changes without looking inward. And specifically, we need to look at how our behaviors squash or foster hope in other people. We know that as we talk about resilience today and the concept of resilience is very, very tough to hold or experience when you don't hold any hope. And when the behaviors that we exhibit contain microaggressions or subtle undertones that we are not even aware of there, that can go a long way towards squashing hope in people and leaving them feeling like nothing is going to change or it's the same old battle. So by looking at those things in ourselves, we become a contributor to the mental health of others. And That is all of our responsibilities in whatever leadership position we're in, is to not just look after our own mental health, but to, in a non-paternalistic, demeaning way, also ask ourselves the question of how can I contribute to other folks' outcomes. Last thing with that in mind is we need to ensure that in the companies that we create and build, that we are taking a hard look about how mental health is accessible, right? In the end, if we want the stigma around mental health to change, if we want dialogues to occur, it is a fruitless hope to dream of those things without ensuring that the access is actually there when people are ready to take the step. And so as employers, as people building businesses, as people who influence people in those roles, we need to look at, do our healthcare plans have access to mental health? Are we offering employee assistance programs? Are we offering anonymous channels to speak up about things that feel like and are oppression in the workplace and beat down mental health for people? We need to look at whether or not we are setting the example of ourselves for those that follow us, of doing our own mental health, of doing our own anti-racist work or anti-misogyny work. If we are not doing that, we are impotent in our quest to make the world a better place. If we do that, we as entrepreneurs, workers, leaders, we have a huge influence, because as we know, right, and we stop and think about it, half of the waking hours of most humans are spent at a job, right? We spend more time hanging out at the desk or doing something for somebody else than we see our loved ones. So much of our time and energy and education and money and sense of livelihood and survival all wrap around the job. And so if we are deliberate about these things and pursue mental health agendas that wrap around social justice agendas in the workplace, then we will become contributors to mental health outcomes. I'll end with one statement that resonates deeply with me, and some authors for any of you that are interested in pursuing these things more. But I would encourage you all that the quote that really sticks with me, or the phraseology that really sticks with me, is that the benevolent wielding of privilege is not equity. That being really good bosses and nice entrepreneurs by itself does not mean that somebody has a chance, an equal chance, or an ability to catch up. So don't confuse your kindness and your generosity for making sure that you are part of putting changes in place that make a difference for other people. On this front, if you want to be part of the mental health journey, contribute to the mental health landscape for populations that are marginalized, who have lower access, lower adoption rates of mental health, let me recommend you towards a couple of authors that have been important in my journey, but Bell Hooks, Austin Channing Brown. There's some great authors out there that can really help you wrestle with privilege and what it's like to walk in somebody else's shoes, and microaggression and subtle rage and things like that. And these are all our responsibilities. If you are a leader, the very definition of the job means that you're at the front of the line. You go first. That's what the word means. So we want these things to be better. Let me end yet again by admonishing you. You have to become an active, vulnerable, self-reviewing part of the solution, and use your companies to do so. So with that, I am going to turn it over to the absolutely brilliant, amazing, wise, innovative, and just downright cool Lorenzo Lewis. Mr. Lewis, take it away.
Oh, no, I'm super excited. Thanks again, Ken, for your endorsement. Bruce, you all over at the Bridgeway and the Venture Center. Truly appreciate the opportunity. It's always a pleasure to share about not only our work, but the work that we do for our community, and the things that we're really pursuing here with Black men and their families, and the work that we're just doing here in Arkansas. I'm really proud of. Years ago, I would have never imagined that we would have been able to strike a momentum and ruling around barbershops and mental health. And so I'm always honored that that has really become a reality. Just as a quick story, I grew up in my aunt's beauty salon, right? Very frankly, I went there probably from the ages of 4 to probably 17 in my teenage years. And just going there every day was a powerful transaction. I never forget going in there, just smelling those chemicals of that they was putting in people's hair, women's hair. And it was roughly about 4 stations, no more than 5. And there was that one barber there by the name of Sylvester. Sylvester was looked at him like a father figure. He was an awesome guy. And, he was indefinitely my first mentor as I kind of grew to understand that what he was doing was he was helping to build and to nurture me to be who I've become now. He would hold me accountable. He made me feel seen, loved, and heard, and truly celebrated. And so in that relationship, I really understood I can go to my aunt's salon and that shop and receive the connection and empowerment that I deserve. And so taking that relationship, I've been able to create with so many other great people in our organization, the Confess Project. And so we are committed to changing not only the mental health outcomes for African-American men and boys between the ages of 6 and 35, but also their families. And so we're doing this by, training barbers on some essential things, how to be a great listener, how to use positive communication, how to reduce mental health stigma, but also how to how to be compassionate and show empathy. And so these are just some things that we know in our communities that are very, very important. And as we really think about, how we've been able to build and corral a movement around our barbers is that we first center this work and them understanding that they must take care of themselves before taking care of their clients. And quite frankly, that's like I said with my mentor, Sylvester there and my aunt Salon, what they realize is that there are people that are coming in and out of their barbershop that they probably will see just like me as a 4-year-old kid with his feet dangling from the seat all the way to a 40, 50-year-old person, right? And so this is somebody that's with them along their life journey, with them during grief, with them during having a newborn child, getting married, all the way to seeing them through college. And so in some instances, what greater way for us to take a culture asset, in the community and really give them some tools. But also what I'm really excited about is that our work has really been able to tie back to working with great partners, at the Bridgeway. I can remember times and times over again of really speaking with personnel there that works with Bruce and getting people that's come through our work and through our ecosystem into getting the care that they deserve. And so over 600 barbers in 30 plus cities at this point, we provide that same support to the same cities across the country. It's just saying that, hey, these shops are just a huge part of the ecosystem of getting people what we call as village care at times, the support and really putting the neighbor back in the neighborhood, right? And so this is just things that we really embody here at our organization through community building. And I really think really excited to know that the Venture Center is doing incredible work with helping entrepreneurs. And truth be told, these barbers that we're investing in, they're entrepreneurs. Barbershops are historically one of the first places that African Americans can own and own a shop and start to create generational wealth from it. And so I think that is phenomenal that we've been able to do a 2-for-1, right? It's really helping to invest in somebody's mental health, but investing into these owners that are entrepreneurs that are now owning barber schools and been able to grow an income and life that they deserve by doing something they love to do and changing lives at the same time. A mantra that we believe here at the Confess Project is that when you confess, you become your best. And so that is a mantra here that with our barbers that we instill in them is a personal value system of knowing that when they are able to support their clients and support that it's a ripple effect in supporting each other. And so I'm really just honored that we've been able to create, but also to have the community come behind what we're doing. I really want to just highlight, some of our reels. What does this look like in real time? How we've been able to help change lives is that, 90% of the barbers that we've worked with over the last few years, and our data and study shows that that 90% of these individuals stated that they rather receive mental health care if it was in the barbershop rather than going outside of the barbershop. And so we know that what we have to configure is that partnerships that we can form with clinicians could at some point help to support in that space. And that 50% of this same body of people stated that they were better informed, about mental health care and having a mental health literacy than they were before the training. And this is our research that we've done with UAMS and the School of Public Health in the recent years that we've been going. And recent data with Harvard University truly shows that barbers can really be mental health and suicide prevention gatekeepers. And our partnership with Harvard University, they have invested to show that this is the science behind this can really be a ripple effect, and that federal and government funding, as it continues to elevate our work, we can really become an evidence-based metric in supporting communities and supporting families. And so in real time, we've had a barber, in the state of Tennessee, very quickly that, he had a client in his chair that was struggling from suicidal ideation and not want to live any longer. And so in that moment, this barber luckily had the training that we provided to really help him around that way and help to empower him. But I also want to tell that also, on the other hand, we've had a barber in Philadelphia that when a client sat in his chair and the guy stated that this was his last haircut. And then when he left the barbershop that day, that he didn't plan to live any longer. And my God, I could feel how I feel in this moment to know if somebody sat down and told me that, if I didn't have the support and the vernacular and the literacy, how that made me feel. And that barber talked about how that kept him up for days, and that the client disappeared and he couldn't find them. And he thought that he had really, made the act upon what he had said. And little known that the client had disappeared and moved because he was struggling and had gotten evicted. And so from his home. And so we know that at firsthand experiences that people are coming in and out of these spaces and common spaces. And I think what's interesting to know is that our work is also, really tied to how we can see our greater world around us. Entrepreneurs, people that are working in other spaces and social services, whether that's in domestic violence or working with our homeless neighbors. These are times where we can really reimagine how frontline, what I call heroes and sheroes, can really support communities and support those that love them and that support them. And so I'm excited that we've been able to bring this a part of now creating such a mass effect of change, but at a grassroots level. And so I think that's what's really important, is that we are building the efficacy and the resilience of our people every day into being able to take charge of themselves and their lives. Ken, I to throw it back at you, but again, I'm really grateful that you all have invited us to share, about how we are, again, just a small part of the change, but I think hugely to really want to see that Arkansas and beyond can have the support that the Confess Project puts out every day in its communities, in common spaces around grooming places such as barbershops. So,
Lorenzo, if a business wanted to support the Confess Project, how do they go about doing that? What does supporting it look like?
Yeah, absolutely. So I think at a very minimal level is public support and sharing our work via social media is always a powerful tool. We're always, as more people know about what we do, is more inclined to helping people. We know, in fact, that one barber can reach up to 100 clients. That is a lot of people that are principals, neighbors, that are people that go everyday working people, to our homeless neighbors, our children, single mothers, the list goes on and on. Some of these are even people that are our clients, depending on what type of industries that we're serving in and what we're doing day to day. Beyond that, I think also as a nonprofit organization, the more funding that we can get, the more barbers we can reach in our work. And so I'm always delighted that corporations like Gillette and his company from Google have supported our work. And so, as we know, largely it's corporations, that also small businesses can support in that way as well. And, also let's not forget that we have a therapist directory of therapists that can be connected to our work, that can be connected to the barbershops that we serve with, because we are only pursuing that barbers will become advocates. But we also want to keep our professionals engaged as a part of the connection and referral process.
Love it. And I don't know if you guys use this term, it's a little bit of a dad joke, but we call all those folks, and there's a bunch of women that do this as well, right? And they're on the front lines. We call them hairapists, right?
Yeah.
Not therapists, but they're hairapists,
Yeah.
right? But they really are. It is amazing what they hear. Can you tell us a little bit about what the training looks like for a barber? What exactly they're being empowered with and stuff like that?
Yeah, absolutely. So in real time, we're training them on, how to engage with a client that may be speaking negatively about themselves or about the world or their environment. So that can look like that barber practicing active listening, or just hearing that client. Maybe they had a bad week. Maybe they lost a close person, COVID-19, as we know recently. A lot of people have, been, have died so much from this turbulent illness that's arisen in our communities. And so, as this client may be going through a lot of grief and challenges about that, that barber's in a position to empower that person to listen, for one, but also to know the symptoms of if there's some maybe erratic behavior or characteristics of this person not want to live any longer, or making comments or statements around homicidal thoughts or anything that may want to harm its environment or themselves. The barber is really in the key role to help navigate that. We're giving them with tools and resources, but they also have the backbone of an organization that has experience of over 60 years plus experience from its professionals and board members and advisory members. So those barbers are told and now being able to connect people with help. Validation is one of the other key roles of, being able to validate someone is a huge thing. Kind of like I talked about earlier, my story with my mentor at the barbershop, Sylvester. Sylvester made me feel valued, loved, heard, and celebrated. And so when people feel heard and they feel celebrated, they feel valued, they often will become more vulnerable, right? Like they will share with you more things when they're more in a comfortable setting. And how comfortable can we get someone sitting in a barber chair with sharp objects and tools? Like they're at a total trust factor at that point, that they trust this person enough to put a sharp object against their neck or to shave them. And so what better way is to know that we've already opened up an opportunity. And so as they validate their client, they feel more connected, and humanly connected to solve and helping that person. Positive communication is another component. Training that person on, how do we positively communicate? One thing is, we know in such a busy and horrendous world at times that we live in, is that men, more frankly, have to take on the weight of the world, and that masculinity, and so understanding that, teaching them what is negative and healthy masculinity looks like. Negative masculinity is being boastful or obviously but at times not knowing how to regulate their emotions, but on the positive side of being open and saying that, hey, that it's okay to not be okay, right? And that this is a normal facet that we as humans can go through, seasonal and transitional things. And that, so in that barber being in that role to communicate that is very, very powerful. And then lastly is how to reduce stigma. I think number one, this training is about reducing mental health stigma. Our goal is to not send nobody directly to a therapist afterwards. Our goal is to reduce mental health stigma so that in our communities, it becomes an opportunity where we remove the barriers so people will want to get treatment. And I think that's where we have to go when you're talking about a community of folks that's, experienced racism and slavery historically. We have to be realistic that we're not going to see people going to therapy as easy. We also come from a faith-based community. And so we have to peel behind the layers of doing the self-work beyond prayer, right? And so we have to think about so many of these, violence and unemployment and so many other barriers that are faced, in Black communities with poverty, that we have to break down stigma first. And from there, we can talk about access to getting help. And I think that's what's important. For years, I struggled with not going to therapy myself, and a lot of being incarcerated as a youth, and coming from a family background of drugs and incarceration. I know firsthand what it looks like to first off to turn to someone that I trust, but that person may be the neighborhood drug dealer. That may be somebody in the community that wasn't a positive, because when you're living in urban communities, they're not lawyers and doctors, and these people are not accessible for young people. And so in fact, I think that's what we have to realize, is that stigma and understanding that mental health is it's a common thing. I think that in the training is really what we're getting across. It's an early intervention. It is a very early peer stage intervention at that. And so I know we've been mistaken for doing therapy, and in a lot of cases, the barbers feel like they are therapists. And in fact, I think in their own right, they can feel that way because of the work that they do day to day on people. But that's not, in fact, what we're pushing along. We're pushing early stage peer support work of how they can help to transform a community at large. So.
Love it. I think we probably got some questions from the audience. I'm going to turn it back over to Annalise here, who will field those. Annalise, you there?
Yeah, thank you, Ken. So yeah, we've got some questions coming in. Lorenzo, I want to ask you, what are some other ways we can make a positive impact on the emotional health of men and boys of color?
What are some other ways to positive impact? I think a big component is this, individuals doing your research, right? Doing your research. I think navigating more literacy. Obviously we know that there's a lot of public. I do quite a bit of just reading and trying to always learn about something different and new. There's tons of. I just have to just kind of raise the roof for a lot of practitioners. Even I know Ken is, doing have done a lot of work there, talking about being anti-racist and practicing these things around cultural competency within the clinical world, but also in our professional sectors. And so I think the first step is always, I think, just educating and finding those educational tools. One organization that I really want to point out, they're a national organization. They're called BEAM, BEAM, Black Emotional and Mental Health Collective. They do such a really great job at really helping therapists, everyday people to understand language around mental health. And so that looks like in real time, someone say that I'm going through it, I'm hurting, right? And so in most cases, in the clinical world, it may come across as someone saying, maybe stating some form of a diagnosis, right? Like, oh, so you may be feeling some type of intrepid mood. And so understanding that communities of color particularly don't communicate in that way, that the communication barriers are very different because of their, also a lot of it's because of the lack of information and understanding they have in general. And then beyond that, it's just the, I think the colloquialism that's tied to this is that's just not how they communicate. And so I think a lot of times is that, that's I think the education piece is research is really huge. And I think just being a lifelong learner of wanting to see better good, when our most marginal community is lifted up by their bootstraps, we truly see a healthy and strong community across the board. So.
Okay, so
I would love to just dovetail on that for a second, that the reminder that to a large degree, mental health and psychology has been developed by white males. And that even our theory of what goes on with people to a large degree is been driven by white males, right? And not that there's not some standout psychologists along the journey. Ironically, Kenneth Clark is one of them, not me, obviously, but Kenneth and Mamie Clark, real famous psychologists. But we have to lift up and elevate and create space for thinkers that don't look like us, don't come from the same backgrounds as us or the same journeys. We have to integrate that as clinicians into our own understanding and listen to those voices, not as simply another opinion, but a unique experience. And cultural competency can't simply be reading a book. It's a recognition that our whole structure of mental health is built on a privileged system and did not have accountability of thought as it was developed. So I'll shut up again, but
no, that's really, no, thank you, Ken. No, Ken, I really value, thank you for, for really bringing that to the forefront. Really, no, that was good. Thank you again.
Lorenzo, I want to go back to kind of the beginning of the Confess Project and talk about outreach. How did you start recruiting barbers, and how did they find out about you?
Well, I always, I have to give a huge shout out to one of our team members, Darnell Rice, who really believed in this vision early on, and he, daringly, kind of traveled the country with us in the early stages just to get the word out. I think a lot of this was, it was just a bold and daring move to want to see just change in our communities, but a lot of it was relationships, being very frank. One barber, that have a lot of influence in the community can really make a huge impact to other barbers that are in the same industries with them. I think that's a lot of it was just peer-to-peer relationship building. I think a lot of it also was that we presented this through a storytelling lens. And so kind of what I was doing earlier is like telling that story of my experience. It was also telling these stories of our experience as African-American men and just going through daily life and going through, prior struggles. And what did that look like in real time? But a lot of those gentlemen and people that were just really able to relate. So I think that was really the second part of it. And I think lastly was, we were so grateful later on to get in a partnership with a Gillette, where we've been able to anchor a huge amount of grooming respect in the industry that now allows us to just reach way more barbers at a much faster rate because of just having a large marketing base at this point. So, but yeah, it was really peer-to-peer, to be honest, and just really grinding it out. And even now, a lot of the barbers, men, they don't understand it. Not everybody doesn't get it, and so I think we've had to build upon the people that do get it. We also know that this, I feel, is way ahead of its time in so many ways. And so we just had to stay committed to that. So no, thank you. Really good question.
Okay, one more. Going back to the training, how do you follow up to, I guess, progress, success, failures?
Yeah. No, good question. So if, at first when we started off, it was really just a lot of trial and error. I think it was a lot of testing out the product, testing out the service, looking at it from the mechanisms of what works, what doesn't work. Let's do this, let's not do this. Let's say it this way, let's not say it this way. Believe it or not, even though we're talking to people that look like us, a lot of it was finding out the right language and the right presentation where it flowed a lot better and they could connect a lot better. So that was a lot of it. Now what we do, it just really huge for our team that does more like a focus group every month, every twice a month. There's like a brain trust barbers call that happened. And on this call is just discussed around self-care and mental health, and also how to help support their clients in a better way. And so I think that's something that we've really invested in, is doing that. We do obviously practice just early, and I think more preliminary, data pre and post with the trainings to really understand how we're, being received, how we can better grow our impact. And so we're just now at a place where we are about to transition to seeing how do we get people into therapies, since we have done more early resource mobilization work. I would like to say in the early phases is how do we transition people into care and what does that look like? And so we're doing work now through a grant in Atlanta, Georgia, to help to show that opportunity of how that transitions long term. So.
Well, thank you. Well, I don't think we have any other questions. So I want to thank the three of you for having this conversation with us today. It's such an important conversation, so I'm glad that we're able to have it. I do want to thank our sponsors, the Bridgeway, Chenal Family Therapy, Frost Accounting, Wright Lindsay Jennings, the Little Rock Regional Chamber, and Simmons Bank. And again, thank you to Bruce, Ken, and Lorenzo for joining us today. Go check out more of Lorenzo's work. He's doing absolutely wonderful things for the community. And Ken and Bruce, go check out Chenal Family Therapy in the Bridgeway. It is Halloween weekend, so have a happy and safe weekend, and we'll see you soon for another Venture Center program. Thank y'all. Thank you, Lorenzo. Thank you,
Thank you all.
Bruce
Thank
and
you.
Ken. Bye, Ken.